And the nurses will only be given like the page where they will sign. They will not
Right.
see the other pages. So there's no transparency. An example for that is, let's say a nurse, international nurse, will have experience in let's say med surg or ICU, and she's been a nurse for 10 years outside United States, and she's applying to the United States as an ICU nurse. So there's a thing called level 1, 2, 3, 4, where you
Mm-hmm.
as a level 1 nurse, which means that you have no experience.
Mm-hmm.
A level 2 will have an experience about 2 to 3 years.
Mm-hmm.
A level 3 is somebody who has more than 5 years experience, say 10. And level 4 is somebody who has like administrative experiences as well, or very expert. The level will be applied into that application. I mean, it will be indicated. So the problem there is some of these employers or recruiters will not write down the experience of the nurses. Instead of giving her the level 3 salary, which is
Mm-hmm.
possibly sometimes $5 more per hour, they are they are documenting the nurses without experience as a level 1, which means it's a fraud because in reality the nurse has an experience, but you just want to pay them cheaper.
Oh.
Now that is called prevailing wage. If
Mm.
your salary goes below, if your offered salary goes below the Department of Labor prevailing wage based on your zip code and based on your level, then that's a violation of immigration law already.
Mm.
So again, this is called prevailing wage, which is the meaning of the minimum salary that that nurse should be offered.
Right.
Yeah,
Mm.
because historically we have a lot of international employees coming to the United States and they're being paid $8 an hour. There was no set limit on how much they should be
Historical,
paid.
that was back then.
Yeah, back then they would come here with $5 an hour salary,
Wow.
whereas their counterpart is already earning 15 or 20. So then the government started putting their Department of Labor has started. It's called prevailing wage,
Mm.
and it's under Department of Labor. FLC data. FLC is foreign labor. Foreign labor. It's where the database where all the salary of international employees will be based on.
Mm-hmm.
So
You want to repeat that? It's FLC department.
yeah, FLC
Mm-hmm.
data. So
Data.
yeah, so this is very open to the public, and it's under the Department of Labor coverage.
Okay.
Yeah, so this is where actually all the salaries of the nurses will be based as the minimum. You cannot bring in any foreign nurse with a salary below that because your application to the immigration is going to be denied because you're
Mm-hmm.
not giving them the proper wage. Okay, so there is a lot of manipulation that's happening during the immigration process. And
Mm-hmm.
when one time I saw this nurse form, the ATA 1989, I saw it and it says the job is in Louisiana, but they're actually in New York City. So when I look at it, well, the Louisiana salary is not as New York City salary, but
Right.
in reality, you're being paid in New York with a Louisiana salary.
Ooh.
And I'm like, well, that's not right because you're not gonna
Mm-mm.
live. They asking me, hey, I cannot even survive here in New York City. I only have $29 an hour. I mean,
Mm-hmm.
$29 an hour. My salary in 2005 was $33 an hour. That's not far. We're already 2024, right?
Sure.
So
Yeah.
I said, that's not right. So we caught that. And we addressed these issues through recommending to the nurses that they should consult a lawyer.
Oh.
And later on, actually, they found out that a lot of them are actually have similar situation. And when the buzz was out and the nurses started getting educated and they started questioning the employer,
Mm.
and then all of a sudden everybody got a raise.
Wow.
And then everybody even got they call it a bonus, but really it's the back pay
Back
of
pay.
this.
Yep.
Yeah, so technically you can see how the recruiters are trying to slip in things just because the nurses didn't know.
Mm.
And when they got caught, Oh, okay, we're gonna correct it. There's so many things in that. So that's the immigration part.
Mm-hmm.
Um, and there was a recent class action that was settled also. It's called
Mm-hmm.
immigration fraud. Whereas the allegation was staffing companies actually was offering jobs to the international nurses, and when the agency submits the immigration document, they're saying these nurses have job in, let's say, Florida. These nurses have job in Maryland. These nurses have job in New Jersey. But then after arrival, they really didn't have jobs there, and they're being sent everywhere,
Oh.
whichever was available. So the U.S. Department of State and the Homeland Security was involved on that. The FBI was
Whoa.
involved on that. It affected 4,000 nurses, and that was
4,000.
yeah,
Wow.
4,000 nurses, and the
Was there a
company.
specific was there a specific territory for those nurses, or was it spread all across the
It's
world?
spread all over across the United States. So
Mm.
it was a lawsuit against a United States agency, staffing agency, and they were made to pay about $9 million
Mm.
of that, and plus $8 million for programs to enhance and support international nurses. So, but tell you, this is only 17 million, right? And the company's revenue every year is 400 million. What
Wow.
is a 17 million, right? What is a 16 million, I would say.
Could you
Right.
repeat that?
Yes, so they're one of the top revenue staffing company in the US with a
Mhm.
revenue annual revenue of $400 million,
Mm.
last couple of years back,
Mhm.
during the peak when a lot of people were doing staffing company traveling. And what is that? It's just like a little slap in the hand,
Yeah.
right? But the good thing about it is being exposed,
Mhm.
and people are getting more aware, educated that this is happening. Whatever I'm telling out there is not a small problem. We're talking
Mm.
about tens of thousands of people involved.
Mhm.
And if you really put in numbers, there are probably 5 million nurses in the United States right now.
Mhm.
And let's say 25% of that are international nurses.
Mhm.
Where you're talking about million affected over the
Yeah.
span of decades. Right? So if you want to put in a perspective, it's how many are affected by this problems with recruitment and immigration process. There is a lot. And we're not even on the arrival right? We're
Yeah.
not even on the arrival yet. The Department of Justice lawsuit were just immigration fraud. Right? So now when it comes to arrival, this is now where okay, you pass through that
Right.
Swiss cheese hole. What's next, right? That's where
Mhm.
the arrival comes in. When I arrive here, my recruiter promised me housing upon
Yeah.
arrival. My recruiter promised me a reimbursement of all the exam fees that I took: NCLEX, CGFNS, IELTS, English exam. Um, so when I'm being reimbursed at almost $1,000, I would use it as a pocket money. I was promised a job as soon as I
Mhm.
arrive here. Well, after arrival, there was no job. They did. They told me, "Oh, you need to do something else before you can start." Okay, but while waiting, do you want to work as a babysitter? And I said, "Where's the housing that you promised me?" Well, you cannot start yet, so the housing's not until you start your real job. And okay, where am I gonna live?
Live. Yeah.
Yeah, I'm in New York City. I don't have family here, right? And you know that I'm waiting for that reimbursement money. You told me I'm gonna get it before my flight, and then you change it again. You're gonna give it after I arrive. Now you're changing again to you're gonna give that reimbursement when I start.
Mhm.
And then are you gonna keep on changing this? Right? So there is a thing called changing of employment terms after arrival, changing of contract. We have a lot of nurses who arrive here with similar situation. When they arrive here, they were being told, well, you cannot start yet because your endorsement of license not active yet. But then the nurse is saying, I've been telling you that my endorsement is still in the process, but you keep on telling me to come here.
Mhm.
And then yeah, we were going to give you a job. Aren't you happy we have a job for you while waiting? And they're giving her a dietary assistant
Wow.
for $14 an hour. And this is 2023, right?
And
So,
that's last year.
yeah, just last year, you're talking about a $14 salary in a new country with your
Mhm.
child on board with you for $14 an hour. You're not going to survive, dear.
No.
So now these people are so devastated because they're just following what the prompt of the recruiter.
Mhm.
And then when the nurse starts to say, "Hey, you know what? This is not the job that you told me. I'm gonna quit. I'm gonna leave because this is not what
Mhm.
you told me, and I'm so already depressed and frustrated." And then the company would say, "Well, we have your green card. We
Right.
have your social security.
Mhm.
We're not gonna give it to you until you promise us that you're gonna work."
Mhm.
And the nurse has no choice but to follow because now
Follow.
they're hostage the green card and the social security. Those are very common, and a lot of this also they would come in and then they would be told, "Hey, there's a new contract you need to sign. That employer before doesn't exist anymore. You need
Mm.
to sign this." And then the nurse just arrived from the Philippines. They took a 24-hour flight. They're not on their best mental capacity.
Right. And
They're
just like.
passing out and they're telling you have to sign this. And of
Mhm.
course, you're given like 7 pages of legal document. Are you going to read
Mhm.
it? Right? The answer is no. It's like giving some narcotics to a person and asking them to sign.
Mhm.
And so, I mean, you don't do that. Even though these people didn't get some narcotics or drugs that will alter their mental state, but they're not in their best mental capacity to sign a
Yeah.
legal document. So it's being done intentionally.
Yeah.
Yeah.
But I had a quick just to add, I had a friend who had a contract, and I think when they finally signed it and when they reached and they realized the pay and everything wasn't matching up, they mentioned something to someone in higher authority, and the response was, "You were at a conscious level one when you were signing." So, and that's some of the statements that
Yeah.
we hear, that you have a contract and you sign, so you
Yeah.
know what you're signing into.
Absolutely. That's always the excuse there.
Mm-hmm.
But when you look at these contracts, a lot of them are full of legal jargons. It's not
Mm-hmm.
easily understood by a foreign national. Because these are based from US legal jargons and legal US employment jargons. I mean, who would know in, let's say, in Philippines, what does exempt means? What does
Mm-hmm.
non-exempt means? What does W employee means?
Yeah.
So these are the languages that are being written in those contracts, and they have no idea. If that is that simple, that can be understood by a regular nurse in the US, that is
Mm-hmm.
not something understood by a Filipino nurse coming to the US. Now you're
Mm-hmm.
putting in there non-disclosure, non-competent, no competency um, clauses, non-compete clauses. I mean,
Mm-hmm.
they have no idea. We went to nursing. We didn't go to law,
Law school.
right?
But then people will say, like, if you get a contract and you don't understand, employ a lawyer.
Yes, correct. So it is the
Mm-hmm.
responsibility of the nurses to really get a lawyer. But the question is, how much are the nurses really earning outside the United States? Can they
Mm-hmm.
really afford a lawyer for that? They barely
Yeah,
have food in the table,
true.
right? And yes, it is risky. They should, but you cannot blame these people also.
Mm-hmm.
So I'm always raising up issues to them. Have you seen people who buy houses? In your experience, Ava, when you buy a house in the United States, there is a certain document that they show you first
Mm-hmm.
that is very universal,
Yeah.
and it's called mortgage disclosure.
Mm-hmm.
Right? You cannot
Yeah.
sell a house or a loan. You cannot sell a house with a loan, a mortgage loan, without putting out a mortgage disclosure.
Mm-hmm.
Never. All right. Even if you buy a car, you don't buy a car and they're just gonna show you this is the amount of money that you're gonna pay. You owe us $35,000. No, there's a thing called invoice price, right? So the car dealership will show you that universal form that is called
Mm-hmm.
invoice price before you go into something. You see it,
Yeah.
the breakdown of it. before you go for a treatment, like in a procedure, like for people getting their braces, you don't just go there and the doctor, the orthodontist will start the procedure without
Mhm.
even first giving you uh, the breakdown of the invoice.
Yeah, all the
Okay.
fees.
Yes, and even when we go use our insurance, there's a thing called explanation of benefits, which is called EOB, which is
Mhm.
very universal form. And when I ask people, why do you think these forms exist? And they said, well, it's easier to understand. Yeah, right. It's easier to
Yeah.
understand. Why? Why is it why does it have to be easier to understand? These people are adults. People who are buying houses are adults. People who's
Mhm.
buying car are adults. But why do you make it easy to understand for them? Because they're called vulnerable population.
Mm.
Even though they're adults, they're called vulnerable population because these legal jargons cannot be easily understood in those mortgage application.
Yeah.
And when you bring out something to protect nurses, international nurses, it has to be in a specific way that's easily understood because
Yes.
these legal jargons are used as a form to really take advantage of their ignorance onto this law.
Mhm.
It's not their intention not to understand it. But again,
Mhm.
even if you hire a lawyer from the Philippines to read your contract, the lawyer from the Philippines doesn't know the 13th Amendment of the United States Constitution, which is
Right.
indentured servitude. For them, indentured servitude is normal,
Mhm.
right? In other countries, this
Mhm.
not exist, but in the United States, no, slavery is illegal,
Yeah.
right? So there are also, important key there that does the lawyer from your country understand the mandatory overtime of New York State?
Yeah,
Does the
that's true.
lawyer know the mandatory overtime of California State? Do the lawyers from that country understand that in California, if you're not in the union, after 8 hours is overtime,
Mm.
right?
Yeah.
And well, even American nurses doesn't even understand it sometimes,
True.
right? And then what happens if you go beyond 60 hours a week? It's called double time.
Mm.
So even if you hire lawyers in your country, it's still not the best resource of a person unless you hire someone for the United States
Right.
in that state, which is very hard to do because if you're in a staffing company, you don't know where you're really going until it's closer to the date, and it
Mm.
can change. So who are you gonna hire, right? It's just a general labor lawyer. That's it.
Yeah.
But the fine prints of it, you have no idea. Um, And then the last part here, Ava, is it's called the employment issues.
Employment.
Yeah.
Mhm.
This is where if you're given in that the three topics that we discussed, the
Mhm.
arrival, full of miscommunication, full of non-transparency, full of fraud, hostage of green card. There's only
Mhm.
one thing that will cliff off. If you end up in an exploitative employer with all those problems on the first stage, second stage, third stage, and they're using that to keep you in a job, then that's where human trafficking can exist. Because
Yeah.
now you have check off exploitation, you have checked off coercion, you have
Mhm.
checked off debt bondage. And a lot of these employers will not tell the nurses that there is a clause in their contract saying liquidated if you leave this job before the term, you will pay breach fees, and the fees will be including liquidated damages.
Mhm.
And if you're a nurse, I'm like, what the heck is liquidated damage, right?
Yeah.
I have no idea what is liquidated damage. I mean, a liquid is a liquid. I mean, do you drink it, right? So we're nurses, It's that oral meds, It's not. I mean, liquid. I mean, what is a liquidated damage, right? So
Mhm.
we don't know that. And then they're adding clauses there or wordings like including legal fees, including the cost of bringing this case into the laws into a
Mhm.
lawsuit, and you also have to pay our future income losses. And I'm like, income losses? So it means if you're earning from a nurse around 80,000 a year,
Mhm.
so it's just 3 years contract. So you're telling me the nurse owes you $240,000?
Mhm.
And it's funny because, I mean, it's not funny that this had happened. But I
Yeah.
was laughing when I saw the lawsuit. Like, what on earth are you thinking to sue a nurse $400,000?
Mm.
So the employer, apparently, when the nurse quit, he sued the nurse $400,000
Wow.
because he said that's included liquidated damages, legal fees, and future profit losses.
And
And
that's
I'm
all in
like,
the contract.
and it's not number, but then when they quit, that's the only time that they will know how much that amount is.
Yeah.
And they said, well, how much do I owe? Well, it's in the lawsuit. It's $400,000.
Mm.
That's what the employer is claiming. I mean, I don't think any court will approve that anyway. Right? And I think the court or the judge should even charge that employer for wasting their time and their resources to try that. I think they should charge the employer for filing that lawsuit because it's really a waste of time.
Mm.
But why did they do it? Right? It's because to scare the people who's locked down on those facilities.
Yes.
It's the reason is to bring fear to our international nurses. So now that's where the problem of crossing the line is this human trafficking. Are
Yeah.
you a victim of human trafficking because you have checked off all the problems? Lack of transparency, holding all those green card, a coercive employment. You have to
Mhm.
come back, or
Yeah.
we're gonna we come back and we dismiss the case. And that's what happened to one of the nurses here in Maryland. She's
Mhm.
scared. She have a 100,000 lawsuit. She doesn't have money. She have kids. She said, "I'm just gonna go back to work," even though she's handling 1 to 50 patients.
Wow.
Yeah. And we even have 1 to 90 patient nurse.
Mm.
It's huge.
19 or 90?
90. And then when I ask, what did you raise this issue to your director of nursing? Yes, I did, because they said it's a night shift that is tolerable because people are sleeping. And I said, what time does your night shift start? And then it said 7 p.m. People are not sleeping at 7 p.m.
No.
And they said, oh, they're just going to be awake for 2 hours. They're going to be walking, but then they're going to sleep. Your 2 hours can lose your
Mm.
license already.
Yes.
And it said, I even have a trach patient. And I was like, a trach patient on a 1 to 90. I mean,
90.
how?
Mm.
I'm like, and he's like, the emotional and psychological trauma is there.
Yes.
And these nurses have they just said, I can't do it anymore. I can't do it. I can't do this job. You're giving me 1 to 80, 1 to 90. It's just ridiculous. I cannot do it. My license is not gonna, it's on the risk all the time, and the patient too. And
Mhm.
I asked them, how often are the fall there? Oh, he said every night.
Mm.
And I'm like, no, run away as fast as you
As
can. No.
fast as possible.
Right. I mean, every night there is a fall. Are we even documenting this? And this is, I said, gonna put your license to risk. It might even be going to jail
Yeah.
if the attorney general gets into you, right? So I said, you get the best thing, but they shouldn't be suing you for 100,000 at all. And I
Mhm.
think it's just done because to scare the nurses who are still working so they don't
Mhm.
leave.
Yeah.
Um, so that's where, again, the abuse of the legal system is happening.
Mhm.
They're threatening that they're going to be sued if they leave. So, yeah, those are the four different journey that they have to go through.
Mhm.
And it's a matter of prayers and deep understanding of what you're going
Yes.
um, to go through. So, if you look at a bigger picture, step aside, it's really a hard scenario.
It is, yes.
And there's like, how many are there that is doing the right thing? How many good employers and recruiters are there?
Mm.
Well, there was a study by the Department of Labor. How many skilled nursing facility, nursing homes, long-term care violated labor law?
Mhm.
And it showed there 80% were found out to be violating labor laws.
Wow.
80%. That was a huge amount of violating. So now your only hope is to land that 20%,
Yeah.
for employer. So the likelihood that this nurse is going to be exploited, that has fraudulent marketing and non-transparency and change of job terms and
Mhm.
violated labor rights, is high likely.
Mhm.
Yeah, so we really need to educate them.
Yeah, educate and advocate. I know we may talk about some of them earlier, but for any international nurse that is out there right now that is on the verge of signing a contract, what are some red flags that they should look out for to say, oh, this is not a good recruiter, not a good agency? Because we do have unethical recruitment agencies, and we do have some with good reviews that do a good job. But what are some what stance can they take to safeguard themselves from that?
So number one is education. There's organization who brings out code of ethics for
Mm-hmm.
international recruitment of nurses. So World Health Organization has actually published that.
Hmm.
International Council of Nurses,
Yes, I know
also
they have one
ICN.
too. Yeah.
Uh, the ICN nurses also work together with CGFNS, Commission
Mm-hmm.
of Graduate Foreign Nurses. So a lot of international nurse CGFNS, by their certification, um, credentialing services. But actually, CGFNS has a sub organization called Alliance for Ethical Recruitment Companies.
Yeah. Yes. Mm-hmm.
So, Alliance actually created a code of ethics for international recruitment. And comparing this code of ethics, it will, comparing it to other available resources there, like the Philippine has their own recruitment law and rules and regulation. They have
Mm-hmm.
their own red flags as well. When I look at the comparison between all of it, I think when it comes to hiring a United States nurse, U.S. nurse, CGFNS has a very good layout of code of ethics. It will lay
Mm-hmm.
out there what are the rights of a nurse. The number one there is transparency. The nurse should
Mm-hmm.
be able to receive all those immigration documents. The nurse should be able to get at least non-pressured time to sign a document.
Yes, very
It
important.
Yes, if an employer telling you have to sign this job now, um, no, I said no. Just give you time, and the time can be 1 week or 2 weeks. Some are even giving 30 days,
Mm-hmm.
and then the recruiter will say, "Oh, this job's not available anymore." I mean,
Right.
trust me, if they give it on day one, if you just talk to them and they offer you a job already in an hour,
No.
that job is still there even after
Mm-hmm.
1 year, 2 years, 3 years, 4 years. It's not gonna go away.
Mm-hmm.
Again, no pressure. If they're asking for signature first before you see the contract, that's already a red flag.
Red flag. Right.
Yep, you cannot sign a contract. They will say, "Oh, this is just a recruitment contract." You will still receive an employer contract. The way to address that is, can I see both before I decide?
Mm-hmm.
Or if I sign this, make sure that you can still back out from the other one if you don't like the other one.
Right.
Okay, so you can sign for recruitment. Some of these recruitment companies are tying up with multiple companies. So they will say, well, if you don't like that one, we're still going to offer you another one.
Mm-hmm.
But then just ask them, can I see all the other options that you have first?
Right.
Okay, so as long as this recruiter is very trustworthy and have good reviews, I think I have no problem signing that.
Right. And no
But
pressure
if
to sign too.
Yeah, no pressure to sign. But if you see a lot of reviews that are negative,
Mm-hmm.
I would hold off with that signature. You never
Mm-hmm.
ever sign anything. You never give your documents to people who's not showing you the entire picture yet.
Right.
And never give money to them. Anybody
Right.
asking you for immigration fees, you have to pay first before they actually file. No, because it's usually the employer's responsibility for the nurse application for I one
Mhm.
forty.
Right.
Yeah, but the dependents are going to be yours. Okay,
Your responsibility.
responsibility. I mean, if the staffing company or employer would sponsor your dependents, that's fine too. But you have
Mhm.
to know what are this term for that. You know, because most likely, the more that the staffing company are giving you for free, it's not really free.
No.
Right? It either can be lowering down your hourly pay
Mhm.
or putting a lot of money into your breach, breach fee or
Beach
termination
free,
fee.
right?
And you will see they're about $30,000, $40,000 breach fee. And some are
Mhm.
even still under on their contract says you will owe the company 2,500 per month.
Per
Per
month?
month. Yes, for 3 years, right? So when I computed that, so you're talking to me that I owe the company $90,000? And I'm gonna tell you, the cost of immigration is not even 20,000.
Mm-mm.
So it's really actually written there, and I've seen lawsuits on this. Many lawsuits on companies asking for that 70,000, 90,000. So
Mhm.
again, always ask for people who are here already.
Yes, very important.
Or if you see negative feedback, don't just close your eyes. I
Mhm.
like to see negative feedback actually more than the positive.